Hello, everyone, and welcome to K3, a special topic session, the basic of impact evaluation. My name is Joe, and I'll be your producer for this session. A few quick housekeeping items before we begin. This event is being recorded, and audio is now broadcasting. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, CMHS, the Center for Substance Abuse Treatment, CSAT, the Substance Abuse and Mental Health Services Administration, SAMHSA, or the U.S. Department of Health and Human Services, HHS. And as in all of our other events, we have the caption link available here. Click the link on the center of your screen. The captions will open in a new browser tab. You can put it anywhere, and you can adjust all sorts of fun stuff on there. If you have any questions about that caption tab, let us know in the All Questions box, and you will find the link sits at the top of the All Questions box. So if you need to scroll up to the top of that box, you will always be able to get back to that caption link. Your lines will be muted during the presentation today, but we do have a couple of ways for you to communicate with us. We have the public chat, which will start below the PowerPoint here. It will shift slightly over to the right. And once we get rolling, I want you to know that the comments in the chat box do not necessarily reflect the views or policies of the presenters, CMHS, CSAT, SAMHSA, or HHS. And everything that you type in that chat box is visible to all attendees. So please be mindful of your colleagues. Use it as a place to network, share resources, have sidebar conversations. It is there for you to use, and we hope that you find it today. And there is also the conference back channel. You've heard about this before. If you use Twitter, you can use the hashtag BHHIVConf18 to follow the hashtag chat on Twitter. You can also network with your grantees and fellow grantees. And if you have a social media person or a marketing guru, let them know about this Twitter tag because there's a lot of great stuff to retweet and share later on. So even if you can't follow along today, please do make note of that so you can revisit it. And I just see we've got a couple of folks coming in unmuted. So we're going to try and mute all people again. Just give us a second here.
All mute off.
Great. Thank you very much. And quickly, we have our All Questions box. In the lower left corner, you'll see that All Questions box. You've seen it before. You'll use it to contact us with any tech or content questions. So if you're hearing an echo or the audio quality is bad or the slides aren't moving as fast as you want them, please let us know here. If you have questions for Madeleine today, please let us know here as well. And briefly, we'll just have everybody agree that they can see the All Questions box. So up at the top of your screen here, you'll see the status icon. That person with their hand raised, use the drop-down menu, find the green check mark, and give me a green check mark. I see lots of folks have done this before. All right. That's certainly more than half, so we're going to go ahead and move on. If you couldn't find it, let us know in the All Questions box, and we will point it out to you. And now I would like to introduce your moderator, Ed Kraft of SAMHSA. Ed?
Thank you, Joe. And welcome everyone to the third and final presentation of the day on the evaluation track, the bigger picture implications for policy change. I'd like to introduce our next speaker for the evaluation track, Dr. Madeleine Wallace. Dr. Wallace has conducted numerous evaluation studies for the National Institutes of Health, and she is a former director of the Office of Evaluation and Performance there. She's also served as a local evaluator for several grantees of SAMHSA, CDC, and the Department of Education. Dr. Wallace is the founder of Windrose Vision, a company that specializes in program development, management, monitoring, and evaluation. You can read more about Dr. Wallace in the BioSketch document. Dr. Wallace?
Thank you very much for the opportunity to discuss evaluations and specifically impact evaluation. So today, the focal point of this presentation is to explain impact evaluation and how the findings can be used to affect change. I want to start by saying that program evaluation let us know whether or not the time and effort we are putting into our programs and services are making a difference. Program evaluation is not just collecting and analyzing data and then presenting the results in a very fancy report. I'm sure many of us have done that. Generally, this report is for the funder and or for the leadership team within the organization. In the ideal world, the findings of the evaluation are used to modify the program, and as a result of these changes, we're going to have better program outcomes. And because we have better program outcomes, we have evidence that the program works, and we can make the case to continue with our program. Evaluation results are meant to change people's behaviors, internal policies of the organization, the way we deliver services, and of course, provide evidence for policy changes. All of us may have seen evaluation reports in bookshelves, or we may have electronic copies stored in our computers. We all have several of those, and I'm telling you, sometimes it's overwhelming. So to ensure that the evaluation findings are used to improve the program and services, it is very important to have a clear understanding of why the evaluation is taking place and who is going to be involved. Because the ultimate goal of the evaluation is to improve the services, it is imperative that the staff and the organization leadership support the evaluation. Now, what does staff support mean? Well, it means time commitment to the collection of data and also to fidelity to the program implementation. You know, the staff has to follow certain protocols. Also, what does support from the organization means? Well, it means that leadership may have to allocate or redistribute resources in a different way. For example, they may have to allocate resources for staff training and also for other evaluation activities. Now, both the staff and the leadership need to be flexible and adaptable. Now, successful policy changes require multiple players with different roles in the evaluation process. Note that we are not only talking about people. If you see all the circles here, we are not only talking about people, we're also including the organization infrastructure. The learning curve to conduct an evaluation is easier if an organization has experience implementing evidence-based programs, collecting data and storing the data in a centralized place, and of course, access to people with expertise on evaluation. It is important to include your partners in the planning process, especially if your program has a referral component. Also, involve members of your community. Do this very early on so that your community are aware of what you are doing and can support your efforts in different ways. They may even provide funding, or they can disseminate the results of your evaluation. Of course, last but not least, the involvement of your partner is crucial. The involvement of your funder is crucial. In a perfect world, your funder will provide specific funds for the evaluation and not just for the services. Now, this is a list of elements, and the reason why we are focusing on this is that evaluation goes hand in hand with sustainability. Sustainability in terms of your program, but also in terms of your organization. With a lot of variability in funding, staff turnover, and technology changes, organizations need an anchor. So here are some elements that facilitate sustainability in the program development phase. So let's go over each of them. Evidence-based program. So what is an evidence-based program? An evidence-based program is the one that has some evidence that it works, and most of those have been done by randomized controlled trials or quasi-experimental designs. This means that they have been able to isolate every influence and not just be able to say the outcome Y is due because these were the elements of the program. We're going to talk more about later on. But in the evidence-based program, there are some evidence that whatever you're doing produces the desired outcomes, and they're very specific. Now, written protocols for program delivery. Anytime you do a program, it is important to have written protocol and not just staff meetings in which the protocols are discussed. Why do we need to do that? We live in a world that changes all the time, and there is a lot of turnover. Even if you offer everything to the staff has different aspirations. So they may look for another organization that meet their needs in their career. So now, if you have written protocols, it is easy to train other people. It is easy to empower the new people, and also it is an opportunity for the new people to make some edits to those protocols. But everything has to be written, and in a way is what we call it a living document that is changing with new staff and also with results of any assessment that it is conducted. Now, document changes in program delivery. You know, most of the evaluation methods have been developed with the assumption that programs are stuck in time, right? They don't change. They don't move. That's it. They're frozen in time. But that is not the reality. Your population changes, demographic changes. Maybe the way you were providing the program has to be changed. So there are maybe the number of hours changes. So it is important that anytime there is a change in your number of hours of your intervention, the type of services you are delivering, who you are delivering, who is teaching the curriculum, or who is providing the services, that needs to be documented. And what does it mean, documentation? It means in terms of the time. When was it done? By who and why and when? Now, the next is data collection systems. Some of you have received some funding from SAMHSA or from maybe other funders to have an electronic records database or maybe any other database where you can put information from your clients. Now, this is critical. It is critical that you have a system to put that information from your clients, and that information is constantly updated as people change addresses or people move from one program to another one. This is power. When they say knowledge is power, information is power, I would say a database is powerful in an organization or a non-profit, or even in an organization that is for profit. Now, having this data collection system ensures that you are well prepared for large grants or to access foundations that provide large amounts of funding. Why? Because you can go back and see different populations. You can go back and research and see the type of your population. You can go ahead and actually say, in the past, I have served this number of people, these were the conditions, and I've been able to do X and Y. Now, the next one is resources to analyze the data collected. In Windrose Vision, we have done several evaluations. And something that we have found out is that many times we collect a lot of data, but then at the end, the client, or maybe the only thing that we need at the end is simple statistics. So you don't need to have fancy statistician in your staff or to have a fancy software, there are many things that you can use just with Excel. So I will encourage you to see what data you have and whether or not it can be analyzed with Excel. But the key here is that you use the data that you are collecting. If you are not analyzing the data that you're collecting, I would say it's a waste of resources, a waste of time, and it's better not to do it. So now, remember, you don't need fancy statistics. Many times, all you need is frequency distributions, the mean, the median. That can give you information that you can use to make changes in your program. Now, strategies to reach and retain the target population. We have given a lot of technical assistance to grantees of SAMHSA, and all our clients, they say, oh yes, we do have access to our target population. We have been doing this for 30 years. We are very successful. And then what happened after 6 months? Well, after 6 months, you don't have any more people because you already invited everybody that you knew. So the point here is that you do have to have a plan how to get new people into your programs. Either they come from other programs within your organization, or either you did recruitment by going outside to your organization, by connecting with other providers, or I don't know, in the past, people used to do a lot of street outreach. I did many of those. So it all goes back to you have to have a plan, because there is a point in any program, no matter how many relationships you have in your community, there is a point in which you are going to saturate the market and you won't have any more clients. So I will encourage you to always think different ways to engage and also to retain your people. So now, your intervention or the way to retain varies. You can have incentives, and many times those incentives are as simple as providing a transportation card so they can go to your facility, or you can offer a meal. But it is important that you want to retain somebody for 4 to 5, 6 sessions, that you come up with a system so that you can reward that for participation. Now, marketing plan. What do we mean by marketing plan? Always think about where you can get different sources of funding. And this starts the moment you get your grant. If you receive your grant on SAMHSA October 1st, that day you should be thinking about how I'm going to get another grant, or how I'm going to get another source of funding in the community, or what foundation in my community or in my region I can apply for and use SAMHSA grant as a leverage. So the marketing plan is in terms of obtaining funding, but also in terms of marketing your program to other providers. So we do not live in isolation. So you do have to go ahead and do a lot of that. And then, of course, you have to have strategies to retain your staff. And if you have written protocols, it makes it easier, because it also shows the commitment of your agency toward the staff, because they want the staff to be well prepared. Then you have to have training materials. You have to have clear program components, and you have to have a clear budget. Now, how much the intervention costs is critical. And tomorrow there is going to be a session about cost-benefit analysis and cost-effectiveness analysis, and we're going to talk a little bit about cost. Now, we enter into the most important phase, that is program implementation. Remember, you have to have a clear definition of success. Now, success means different things for different people. And also, not only within your organization, but also for your client. So everybody has to be on the same page. Everybody needs to know, we want to reduce substance abuse, or we want to enroll more people in our program by this amount. So everybody needs to know that this is what we want to do. Otherwise, when you do an evaluation, at the end of the day, everybody is going to be confused, and there is not going to be engagement, and the results are not going to be used. And all of this that we're doing right now, that we're talking about, is for you to be able to utilize the results of your evaluation. Now, you also need to have support and research. It is always good to have handy to show why are you using that intervention in your particular population. Have there been any articles? Do they have any data that support that, yes, it is applicable for your target population? If it's not, you should have addressed those issues in the early phase, in the planning phase. Now, going back, you need to document how the intervention works, how you do the enrollment, how much dosage, like how many hours, how many times a week, frequency of delivery, if you're doing 3 times a week, once a month, 3 times a month, and also any interaction with the program within and outside your organization. Now, also we need to have clear outputs and outcome metrics. And by that I mean, like in terms of outputs, I mean that it's important that you track how many people attend the intervention. And that is just an output, the number of people that participated on something. Now, in terms of outcomes, we're talking about, like for example, changes in knowledge, changes in attitudes, changes in behaviors. Now, you also need to have the system to track your clients as you are implementing your intervention. And the most important one is the feedback loop. Now, it is important to have a customer satisfaction survey, but make it very specific toward your intervention, and not just something that says, do you think this intervention was helpful to you? And people will say, yes, or I'm satisfied. That doesn't mean anything. You have to be very specific. If you are interested in one specific component, you have to ask a question about how do you feel about the recruitment in the streets about this program? What do you think about the 2 hours mentorship class? Was that effective? So it has to be specific to a component. It cannot be a broad for like, what do you think about the program? This way you can use the results of your customer satisfaction surveys in an effective way. Now we're getting to impact evaluation. So now, I'm sure that you have heard the term impact in many different ways. So the way we are defining impact evaluation is basically when we are trying to see the net effect of a program by comparing the program outcomes with an estimate of what would have happened in the absence of the program. So here you have to have, in a way, a comparison group. So sometimes people talk about outcome and impact evaluations. So these are 2 different types of evaluations for the purpose of this presentation. We are talking about, you can have an outcome evaluation and may not necessarily talk about that you are assessing the effects of the program and comparing with another people who did not experience the treatment. So I'm going to go and explain a little bit more about this. And also, when we're talking about impact evaluation, we are talking about positive as well as negative effects that are a result of the intervention. It is extremely important to report not only the successes, but also the challenges and the areas where we did not succeed as we intended. Now remember, success is defined by you. So, and success has different ways of measuring. So when you are planning your evaluation, you have to be clear about what you define success. Now, key thing in this slide is that impact evaluation are best used when external factors that may affect your outcome are known. Okay, so now we are going to talk about the impact evaluation. So again, what would have happened without the intervention? This is actually the $1 million questions. Everybody wants to know that. We live in a time in which everybody is looking for evidence. The trend is marked by the shift from inputs to outcomes and results. Results are being used by program managers to enhance accountability, determining budget allocations, guide program design, and policy changes. So what is this impact evaluation? For example, if we have an intervention to reduce substance abuse, and the intervention consists of 10 sessions, and we have 100 clients going through the intervention, the question is, what would have happened to the 100 clients if they would have not gone through the intervention? One way to assess this is by comparing the outcomes of the 100 clients who have participated in the intervention with the outcomes of clients who have not participated in the intervention, so that we can attribute the changes in the individuals to the intervention alone. So again, the only difference between the treatment comparison groups should be that the members of the treatment group will receive the program or intervention, while the members of the comparison group will not. When the difference in outcomes can be entirely attributed to the program or intervention, the causal effect impact of the program has then been identified. Now, we are talking about here a very strict interpretation of impact evaluation in terms of you have to have a counter factor, and that is the next slide. The attribution requires the identification or a causal link between the intervention and the outcome of interest. So you need to identify very clearly what are the alternative explanations to the changes in the outcomes. So the main challenge is then to find a comparison group that mirrors the treatment group. And also, in our field, we have challenges in terms of should we not provide services to some people and have them as a comparison group. So there is a lot of challenges on doing this. So this is why nowadays there is something else that we have going on, that it is called contribution as opposed to attribution. So there is a new train of thought that tells us that we cannot really focus too much on attribution, cause and effect, but we need to be thinking about the contribution, meaning that your organization is contributing to this, but also there are other factors. Maybe these individuals that are in your treatment group, they also were exposed to other programs. So the reason why now they are successful is not only because of your program, but it could be because they received some type of intervention with other organizations. And maybe the comparison group, you know, there are spillover effects. So there are other issues that maybe they got some type of intervention because they heard it from their friends. So my point is that you have to have very clear understanding of what can you control and what is beyond your control or beyond your intervention. Now, it is possible to do one? Yes, it is possible. It is possible to do quasi-experimentals? Yes. It is possible as long as you know your boundaries and as long as you know what are the pros and cons and what are the things that you can do and you cannot do, and because it's going to affect you, the interpretation of your results. So you really want to identify for who and how much of intervention of hours or doses you need to provide to your population to achieve certain results. Then you need to focus on that, and your impact evaluation should focus on those characteristics, and it shouldn't focus on everything. So I think the issue is that if we try to focus too much, then we are not able to reach the desired goals. We're not able to achieve the outcomes that we want, but also we're not able to have very good impact evaluations. So now, why do you want to do this? If you're saying, oh my God, there is so many issues, why do I want to do this? Actually, remember, we live in a time where you have to have some evidence. And there is a ranking on evidence from weak to strong. So you make a decision how rigorous you want to go, or your funder will tell you how rigorous you need to be. So now, you want to use it when you have a new or a homegrown intervention or a strategy. So you don't have data about it, and you really think that it works, and you want to be able to either spread the word about this, you want to go to use it, you want to be able to scale up, so this is a good time to do your impact evaluation. Now, let's say that you want to use an intervention, but you want to use it in a different setting, like it was used in nonprofit organizations or community-based organizations, and now you want to apply it in a clinical setting, or the other way around. Or you want to apply to different populations. Now, the reality is this. Most of the evidence-based interventions that are currently disseminated are not applicable to every single population. An adjustment, a tailoring, and adaptation process must be taking place before it's being implemented to the population that you really want to reach. So you have to assess how much adaptation and tailoring the intervention went through, because if it went through so much intervention and adaptation and tailoring of the message, the hours, the people, everything, you may have to go ahead and do an impact evaluation, because whatever you're trying to do is something very different than the evidence-based intervention that you started with. Now, also, it is important to have hard evidence on what works. And again, there is two trains of thought. Some people say, well, I know it works because I've seen it on people, and there is a lot of anecdotal evidence. Now, I'm not saying that you should discard qualitative research. No. Actually, qualitative research helps you to interpret the results of the impact evaluation. Because when you do an impact evaluation, you're quantifying the effect. But the explanation is not going to tell you about the specifics of the contextual factors of the intervention. That tells you when you do some qualitative analysis. So the qualitative component of your evaluation, that is what it tells you in terms of explains why you had the outcomes that you see. So hard evidence works in terms of numbers, but also can work in terms of qualitative research. So you can do qualitative research very systematic, and you can use theories, like the ground theory, and then start from a hypothesis and then come up from the bottom to the top. Or you can go the other way around, from the top to the bottom. The point here is that you have to have some evidence that your outcomes work, or your intervention work, that whatever you are preaching actually has something to back up. Now, you have to be able to inform, to use the evaluation results to inform your decisions. Now, it will be wonderful if all evaluations can be used to make policy decisions. Now, I'm talking about policy in a broad sense. Policy in terms of your organization structure, how they do things. Policy in terms of how you retain and how you train staff. So policy shouldn't be limited just to changes at the level of the federal government or at the state level. The policy should be at all levels, from your organization, and then from there going to the organization, to other organizations at the state level, and then at the federal level. Because if we start from changing policies at a larger level, many times we do not know how to translate those changes into our local communities. Now, why you shouldn't do it? Well, I think that you shouldn't do it if you don't have the resources, if you have not done a budget. You do need money, you need expertise, you need time, you need flexibility, and you need support from a variety of stakeholders. Now, remember this. You are not measuring the success or failure of your program. It's actually expanding your knowledge of how to do what you do. Why? When we have done several evaluations, actually the staff who participate in the evaluations are the ones who benefit a lot, because they learn to look at their program from a different perspective. So it's an enrichment, not only in their careers, but also in the way they are going to provide the services to the people, to the clients. So you need to take evaluation as a way to expand the knowledge of your staff. Because even if you don't achieve the outcomes that you wanted, your staff is going to be well trained and is going to be able to provide services in a different way, and we're going to have different outcomes. And who knows, maybe we come up with a different intervention. Okay, so the next slide, and I hope you guys are awake. So I haven't seen anybody leaving yet, so that's good. So even if you have left, you haven't turned off your computer, so that's good. Okay, so lessons learned. Don't worry, there's going to be time for questions and answers. Okay, so highly complex impact evaluations take a long time to design and implement. Actually, I think it's better to plan an evaluation, spend a couple of months, and then realize that this is not the time to do it, as opposed to do the planning very fast, start with implementation, and then realize that we do not really have the resources, or the intervention was not ready for an impact evaluation. So the design and implementation is a long process. So how can you do to speed up this process? Well, our advice is that you need to have a working group. In WinRose, when we have done evaluations for the National Science Foundation and also for the National Institute of Health, we have an external working group. They're experts, there are people from the field, so we have a variety, people in the field, so a variety of people, and they actually drive the design, the data collection, the outcomes. They feel they're part of the project. And it's true, we're contractors, but they provide input, and we incorporate the feedback. That's a commitment that we have. So if you have a working group that is composed of different players, it will speed up. Why? Because remember, you need to get buy-in from everybody. One way to get buy-in is by having this working group. Now, the other thing is you have to have frequent communication. So many times, if you have an evaluator and you may see it like once a week or maybe once every 3 months, or when you have to do the reports, well, that's not pretty good. That's not our advice. That's not good practice, because you need to keep everybody involved. And we're also talking about in terms of the staff. So the grantees, the funders, the evaluators, anybody who's involved needs to have frequent communication. And I'm not talking about long meetings. I'm just talking about even like one email and say, hey, we accomplished this. This was very successful. Thank you. So it keeps somebody involved, engaged. Engagement is the key. Now again, we're just talking about the budget that you really have to determine very early on. And then you have to have support from the leadership. And if the leadership is not invested, it's going to be very hard for the staff to actually carry out the activities. So it is very important that if you're the program director, that you talk to your funder, you talk to the people involved and say that the executive director needs to be involved, so that everybody knows what needs to be done, because then the evaluation activities need to be shared with the service delivery. So if the staff is involved in data collection activities, then you really have to have a reorganization, or you really need to have about specific responsibilities for each staff. Now, let's see that you offer referrals. So then it is important to have those data sharing agreements, right? And it may involve several discussions. It may involve that you have to share some of your funding with your partner. And it is important to recognize this early on in the process, especially if you want your referral to get back to you, because it's not so that we just refer somebody for a vaccination or we refer somebody to a shelter, but also we need to know what happened there. So the shelter or the clinic needs to go back to you and tell you, yes, this person received the vaccination, or this person was admitted in the shelter or not. So you have to close the loop about referrals. Now, site visits. it is always good to have site visits from your evaluator or from your funder. Now, if you are participating in a SAMHSA cross-site evaluation, I encourage you to participate on those site visits, ask questions, because remember, you are part of the process and not just to collect data or to provide data. Now, one key thing is that the standardization of the procedures. And I'm not talking only about if SAMHSA does a cross-site evaluation where you have to use the tools from SAMHSA, but also I'm talking about within your organization. Standardization is the key to success, and it minimizes a waste of time. Why? Because if you start always reinventing the wheel, at the end of the day, everybody gets tired. So if you standardize your data collection tools and procedures, then it is easier. Now, IRB. Some of you do need IRB approval in order to start data collection. So it's important to go ahead and do that. It's important to plan in advance if you need that, and that is in the planning process. So sometimes it's recommended that you talk to a university to do that. Now, another lesson learned that I would like to emphasize here is that, remember, there is always going to be selection bias. So you have to talk to your statistician or whoever is going to analyze the data so that maybe those areas can be addressed in the statistical analysis. Then the other thing that is important for us is that you always have to make a decision between doing something electronic and sophisticated, such as, for example, a web system, as opposed to doing just collecting the data by hand, I would say. So you may spend a lot of money at the beginning, but at the end it's going to save you. So you do have to do your little calculations and say, okay, is it worth it for me to spend this amount of money to gather the data or put the data right now electronically, or just, do it by hand? Why? Because think about this, you have to minimize your error, and cleaning of data is a very arduous and costly process. Most of the time when we work with grantees, when we work as well with the government, we spend a tremendous amount of time just cleaning the data, and also in data entry. So remember, the person who does the data entry for you actually has one of the most important jobs, because garbage in, garbage out. So if we empower everybody from the very beginning and tell them every position or every person who works on evaluation has a key role to play, then we get buy-in from everybody, because everybody sees how they fit into this larger black box that is the evaluation. And we don't like that. So it is important to identify exactly who is doing what, and also what should be done electronically and what should be done manually. So I have spoke, I guess, for 45 minutes. That's a lot. So I'm ready to answer any of your questions. Please don't be shy. And if I don't have the answers today, I will be glad to provide the responses to Dr. Kraft, and they can send it to you. Or if you need more information, I'll be glad to provide information to Dr. Kraft so that he can send it to you.
Okay, Madeleine, can you hear me?
Yes.
Okie dokie. We have a question from Blanca Galvez. So thank you for your presentation. Please expand on the possible ethical dilemmas of using comparison groups.
Yes. So one of the ethical dilemmas is that for some interventions, you do not want to delay the intervention, because usually when you plan an impact evaluation and you have a comparison group, you can provide an intervention later in time, but sometimes that is not possible. So you really have to go ahead and work with the IRB. You really have to work with people that can tell you what are the different options. Or maybe you can have what is called this, the standard versus an enhanced intervention. So in this case, everybody receives, in a way, they all receive something, and only one group receives a little bit more. So right now, that is very popular for that. And you have the status quo versus an intervention that is enhanced. So there are, yes, there are ethical dilemmas about that. Also, many people say that there are topics where this does not apply. And as I say, this requires you to have a clear understanding of the intervention to identify which components are the ones who are going to present a challenge and which components should go ahead and be assessed and evaluated.
Okay, our next question is, what is the difference between outcomes and impacts?
Okay, so when we do an evaluation, we think about outcomes like initial outcome, that is the results of what it's basically your goals, let's talk in this way. So you have an initial outcome, then you have the intermediate outcome, then you have a long-term outcome. And when we're talking about in that terminology, because it varies by different, as I say, there are different terminologies in evaluation. So we are talking about changes in knowledge, behavior, changes in knowledge, attitudes, and behavior, right? But many times when we're talking about an outcome evaluation, we are not necessarily talking about on having a comparison group, on trying to isolate and see what would have happened in the absence of the intervention. So for the purpose of this presentation, that is the major distinction. That in the impact, the way we use it is that you do have to have a counterpart, a counterfactor. What would have happened if you didn't provide the intervention? So that is one of the distinctions. Now, another way is that some people say that long-term outcomes are equal to impacts. So there is a body of literature that also tells you that impacts are the ones that when it's not only just changes in your program, in your organization, but actually are changes to the entire community or changes at the state level. So if all of you are trying to decrease the number of people with HIV, but it's only in your county, now you will go to the state, and that could be considered an impact. So as I say, it all goes back to what philosophy or what theory you're following. And it's important, this is the most important question. You need to be very clear what people are calling outputs, outcomes, and impacts. Otherwise, when you're doing your evaluation, people are going to be confused.
Okay, next question. If my organization is implementing an evidence-based intervention, is an impact evaluation necessary?
This is an excellent question. So the majority of the evidence-based interventions need to be tailored, need to be changed either in terms of their population or in terms of the length of the intervention, in terms of the content, in order to meet the needs of a specific population. So if the changes to the intervention are not substantial, you do not need to do an impact evaluation. But if you have changed the population, the content, the length of the intervention, who delivers the intervention, you do have to have an impact evaluation because what you are producing is something completely different. Now, remember this is a very tough question because, as I say, what a substantive changes mean. So basically, when you have an evidence-based intervention, you need to list all the changes that need to be made or all the modifications. And then you need to discuss this with, if you have access to the developer, you can discuss with the developer, or you can discuss with other people in your community, other providers that have experience with intervention, or you can discuss with your funder, or you can discuss with your evaluator. But basically, you do have to assess whether or not the changes made to the intervention are completely different. So we have a process that we have put in place to actually assess that, and it's like a checklist. So the idea is that basically you have to see what were changed and how much change was done, and in order to see if you need to do an impact evaluation, so that you need to have a comparison group and redo everything because everything changes. So remember, if you change the length and you change the population, and you change who delivers the intervention, and you change the content, that is basically another intervention.
Our next question is, I am a program director. What can I do to motivate my staff and my executive director in the evaluation we are currently doing for my program?
Okay, so this is also a very good question that everybody faces. So the strategies I use with staff are going to be different than the strategies to use with leadership. So for the staff, one way is that the evaluation actually enhances the knowledge for everybody. It offers you a different perspective of how to provide services, of how to record the services, and how to track the participants. So I would say that you need to work with the staff in terms of looking at the advantage for that person. Like, what is in it for me? Actually, that's how it goes back. So you say, this is a way to enhance the skills of the person. So it's a learning opportunity, enhancing the skills. How it is translated? Well, it is translated because then the person can put in their resume that now has participated in evaluation and has expertise in data collection or in gathering data from clients. That is very important. Doing interviews. Not everybody can do an interview. Not everybody can do motivational, behavioral motivation interventions. I mean, my point is that you have to identify the specific skills that the staff will learn by going through the evaluation. The other one is the specific challenges that they're going to be faced by the staff. One of the challenges is that their time commitment is going to be split in doing evaluation activities and also doing data collection. So that many times it can be overwhelming. So I think it's important to have flexibility maybe in the schedule and to say what are the new responsibilities based on the new requirements of the evaluation. So then everybody's clear, as opposed to say, all right, it's going to be okay, what a board, and then we're trying to accomplish too much. So you have to be very clear about how much time commitment for the different activities and also who is doing what. I think when you're doing an evaluation, you cannot really say, well, you know, whoever is available. You really have to have clear assignment of roles. So that will be for the staff. And also, perhaps you can also provide incentives to the staff to participate in the evaluation activities. It cannot be necessarily be in terms of monetary participation, but it could be in terms of, I don't know, maybe time off, maybe flexibility in their schedule. So now in terms of the executive director, I think it is important that if you are a nonprofit, that your board knows that your organization is doing an evaluation, and your board knows how you plan to use the results, and also that you show to your executive director how the results of the evaluation can help you to bring funding to your organization, and also in terms of sustainability of the program in the community. So remember that the priorities are different from different people in the organization. So the role of your executive director it is also to see what is going to be the future of your organization. So she or he has to be able to see how the results of the evaluation are going to help the organization. And if we are not able to provide that to our leadership, then we're not really doing a good job. Because remember, the evaluation is supposed to be used to improve the program. If the evaluation is not going to be used for anything, as I say earlier, it is better not to do it because it's a waste of time and resources for some people. So, that will be my thoughts about this.
All right, we have no more questions, so thank you very much. I think Joe's going to wrap us up.
Thank you, Ed, and thank you, Madeleine. Madeleine's contact information is up here on the screen, and again, all of these slides will be sent out later on along with the CEH information, so you will have an opportunity to download all of them. I will leave it here for just a moment if you need to copy anything down. If you don't have time to copy it down, if I switch the slides before you get what you need, let us know in the public chat or the all questions box, and we will try to get you the information that you seek. We thank you for coming out to today's conference. We will be back here again tomorrow. We have the BH-HIV contact information up here on this slide, so if you see something you would like to email us about, you can click this link here. It is a live link. It will open up an email in a separate window, or you can use the phone number here. You can jot that down and give somebody a ring.